Let's turn our attention now to Beales in Poole. Inside Poole's Dolphin Centre, there was an enormous Beales. There was a huge retail space. The NHS are now using it. Ashleigh Boreham is the Deputy Director for Design and Transformation for Dorset Clinical Commissioning Group. Ashleigh, good morning.
Good morning.
Was it a space that just became available, or is it more targeted than that?
It was more targeted than that. So the idea of repurposing and finding space so that we can tackle the outpatient problem and the waiting lists within Dorset needed us to find a different way that we could use health operations in a different space that we could design from the start. And the kind of places that have those big wide open spaces are department stores, because they allow you to your imagination and rethinking how you can do things.
We've heard from different experts across Hampshire, Dorset and the Isle of Wight who have to handle these big retail spaces that become available. And certainly in Portsmouth, they're saying if we're going to put more residential in, they could easily see more NHS services coming into spaces like that. Do you agree?
Yes, there's even think tanks. So the King's Fund in London have all written papers about how you can repurpose retail spaces in the community, and the NHS is known as an anchor institution. It itself brings footfall to these places. It brings people to the community, but also it allows us to connect with the community in a better way.
With regards to the space being in there, was it an easy fit to set up something clinical amongst really areas that sell donuts, coffees, coats and, all sorts of bits and pieces?
Yeah. So we're not. So the way we've done it is we've been given a separate floor within the Beales. So Beales is still operating on the ground on the first. We will take the second floor, and it will be completely for us. So you won't be able to go buy some donuts and also some healthcare exactly at the same time. The idea is that because it's when you take away all the shop, you can really it's like a shop fit. But in a sense, it's done to a healthcare standard. So we are creating consulting rooms for outpatients. We're creating a breast screening, and we're creating ophthalmology. So we're able then to have lots of consultant rooms going on, and it's in a place that's easy accessible. And it means that people don't have to travel to hospital, because this is not a place where we treat people. This is a place where we assess people. So it's people that need to be assessed and to reassess them and triage them on their journey to make sure that we're managing their healthcare.
Yeah, it makes sense, doesn't it? You've got the parking there, you've got people there anyway, you've got people shopping anyway. So it seems like a natural fit. Ashleigh, before you go, is one of the challenges I suppose I'm thinking one of the negatives possibly is the walk-in. The person who's just walking past and then thinks, I'll pop in because I see the NHS brand, and they think, I'll just go there rather than my GP. Is it hard to help people understand what you're exactly there for?
Yeah, so it's really important that we communicate what we're there for. So it's like a normal outpatient, so it's not a drop-in centre. And so it will have a normal reception. You normally will do your normal booking system you would do for an outpatient appointment. The difference is that it is more accessible for us. It allows our people to work in a different way. It's still a very good clinical environment, and it will give top level assessment and diagnostics to our people. But absolutely, it's not a drop-in centre. It is about a normal outpatients department. You just go to a different location. It's a little bit more accessible.
It seems perfectly sensible now. Now it's happening. It seems a perfect fit. Thank you for that. That's Ashleigh Boreham there, Deputy Director for Design and Transformation for Dorset Clinical Commissioning Group. We're talking about the High Street, those big spaces that are left on the High Street, and the NHS are now using a floor in Beales in Poole. If you know the Dolphin Centre, there's a huge Beales in Poole. Beales have some of it. There are independent traders in there as well, but an entire floor has now been swept up by the NHS.